So, welcome to the June 2025. My name is Erica Botner. I'm the program manager for seniors and the SHARP program at CHSSN, the Community Health and Social Service Network. I'll be the facilitator for today's session. And today we have three master students from the pharmacy program at the University of Montreal who are going to be talking about the role that pharmacists play in helping older adults to age in place. They'll talk a bit about the changes to Law 31, which affect what they can help with and what they can't, and what they can do versus what doctors and other medical professionals do. So we have Lindsay, V, and Kevin, who are a team of pharmacy residents finishing their master's degree with the goal of working in hospital settings. Before this, they've all worked in community pharmacies. Therefore, they understand the challenges that older adults face managing medications at home. Their experience in both settings helps to give practical advice on how to age safely while staying independent. So I'll hand it over to the speakers.
Hi, my name's Kevin. Today I'm joined by V and Lindsay, and we're pharmacists currently training to work in hospitals. And today we're going to present to you how your pharmacist can help you age in place. So in terms of objectives, first of all, we're going to describe key pharmacy services, and then we're going to differentiate when you should seek guidance from a pharmacist versus other healthcare professionals. And lastly, we're going to present to you some online resources that are available to you to help you age in place. So what does aging in place mean? So we define it as living safely and independently in your own home as you age. And there's different factors that can influence your ability to age in place, such as your healthcare, your home environment, your personal care, so activities of daily living like household chores and meals, how you manage your money, and your use of transportation. And there's different healthcare professionals that can help you with your ability to age in place. However, for now, we're going to focus on the role of the pharmacist first, and then we'll talk about the other healthcare professionals during the presentation. So we're going to talk about the role of a pharmacist. So the pharmacist is a healthcare professional who specializes in preparing and dispensing and advising on the proper use of medication. We ensure prescriptions are safe and effective, and we educate patients on how to take their medication, and we monitor for drug interactions. So we're going to test your knowledge now. The first question is going to be true or false. Pharmacists can change your medication doses without asking your doctor. So the answer is actually true. In many cases, we can adjust doses without asking your doctor first, but it's not for all medication. For example, narcotics, we can't adjust the dose. True or false, pharmacists can prescribe medication for minor conditions under certain prerequisites, such as urinary tract infections and cold sores. The answer is true, and we'll talk about it later on in the presentation. And then the final question, true or false, if you experience a new side effect, you should always contact your doctor first. The actual answer is false. Pharmacists can often assess side effects and then recommend the next steps and then tell you when it's necessary to consult your doctor.
All right, so I'll tell you what generally pharmacists can do. We already talked about the role and had a few questions. So first of all, one of our main jobs is to do medication review. So we see if, for example, you still need that pill or if it's safe to take with other medications or the foods or other activities that you do in your daily life. We also give adherence support, meaning if ever, for example, you have a lot of pills and you have difficulty managing them, we can help you by putting your pills in what we call a dispill, where each day and each time of the day is identified to tell you when to take your pills. We can also prescribe for really minor conditions. So meaning, for example, UTIs, urinary tract infections, cold sores, or certain rashes. So instead of going directly to the doctor, you can come to us and we can prescribe it to you. Um, and also we can help with side effect management, meaning if ever you feel any side effects with your medications, we can either adjust your medication or also prescribe you certain medications for that side effect. So this is a really long list of the things that we can prescribe. We'll go through a couple of them that we think are much more pertinent for you. So the first, the ones that we're going to talk about are listed here. So we're going to talk about cold sores, UTIs, smoking cessation, shingles, and the flu, and also the fact that we can prescribe vaccines for you. So first of all, what is a cold sore? A cold sore is a viral infection from the virus named herpes around generally the mouth. So in terms of symptom, it's really a rash with some blisters, so where it looks like it's kind of fluid filled. It can be kind of painful, a bit of a burning sensation, itchy and tingling. And in terms of treatment, we normally prescribe antivirals. The only restriction that we have as a pharmacist is that you already need to have a prescription that's been given to you in the past 5 years for it. Now, for UTIs, so UTIs is a urinary tract infection, meaning there's a bacteria that grows in the place where you urinate. In terms of symptoms, it can present itself kind of in different ways depending on the person, but the general symptoms are, for example, burning sensation when you urinate, or if you kind of feel like you have to go pee really often, but it always comes out in small quantity. The urine itself can be kind of cloudy or strong smelling, and you can also have a bit of pain in your lower belly. In terms of treatments, it's antibiotics, since it's a bacteria. The only restriction that we have again is that you already have a prescription of an antibiotic for this condition in the past 5 years. Now from smoking cessation. To stop smoking, it can be a really difficult task, and pharmacists can prescribe you treatments, whether it be pills or, for example, patches, to help you quit smoking. But other than the medication itself, pharmacists can call you and do follow-ups to see how is it going and how else we could adapt the treatment and how we can adapt the smoking cessation to you. Now for shingles. So shingles overall, it's an infection of, again, herpes, the same virus as chickenpox, on a certain nerve that you have on the body. It's very contagious, and it could present itself in different ways. Generally is a rash that looks like blisters, kind of like the cold sores I was talking about, but it's really in a specific band or stripe, and it can be very painful, have a burning sensation, and be itchy. In terms of treatment, we can prescribe the antivirals for it. It's just that we have a couple restrictions, the first being time. So if you've had the symptoms for more than 3 days, we can't really prescribe it to you, but we'll refer you to the doctors. And also depending on the place of the face. So for example, if it's on the face, it's a bit more tricky. It can have a lot more complications. So we'll probably refer you to a doctor then. Now for the flu, so it's something that we've probably all heard about. It's a yearly seasonal thing. It's a virus that infects your throat, your nose, and your lungs. It is contagious. In terms of symptoms, um, it can it normally presents itself as general, like if when you're being sick, it can be fever, coughing, sore throat, kind of like muscular pain and congested, kind of leaky nose. But what it differentiates itself with other types of sickness, it's really its sudden appearance. It just appears like this. And in terms of treatment, it's antivirals. Um, the only thing is that we have a restriction of time since its appearance. So for the last two things, for example, the shingles and the flu, it's things that you can prevent by having vaccinations. And gladly, now pharmacists can prescribe the vaccinations and even give you the vaccinations ourselves. So there's the shingles and the flu that I've talked about, but there's also, for example, COVID. There's the tetanus shot. We can prescribe almost any of them except for yellow fever. Other than vaccinations, we can also administer other medications, for example, to demonstrate you how it's done. So for example, if you have a new medication that requires an injection and that you've never done it before, we can show it to you to tell you how to properly do it, the preparations, and after for it to be safe for you. And we can also administer medications in emergency situations. So for example, if you have asthma and COPD and you really have difficulty breathing, we can give you Ventolin. We can also give you Narcan or EpiPen if ever you're really having a severe allergic reaction, and also nitroglycerin if ever you have really difficulty breathing and chest pain. Um, so one of our jobs is also to monitor your drug therapy. So by the way we can do that is, first of all, we can prescribe you blood tests to be sure that the medication is, first of all, safe and it's also effective. And we can also adjust your medications depending on if, for example, as I said before, you have any side effects or if ever there's any interactions that maybe we should adjust your medication for. And also, for example, if you see that your medication is not as effective as it could be, we can also adjust it to the upwards for you. And we can adjust it in very different ways. So it can be the dosage itself, but it can also be, for example, we can split the dose for if normally you're taking it once a day, we can do it that you take it once in the morning and once in the afternoon if you have really bad nausea with it, for example. So just be sure to ask your pharmacist about it, and we'll really adjust it according to your specific case. And we can also now extend prescriptions, meaning if ever your prescription doesn't have any more refills from your doctor, we can give you a couple more until you have another appointment with your doctor or until he sends a new prescription. Because sometimes we can also send a small fax to your doctor and ask him for more prescriptions too. We can also substitute medications, meaning if ever your medication is either out of stock or it's not available anymore or it's not safe or effective for you, we can change it to a different molecule or another agent for you for those reasons.
Now we're going to go into the section of differentiating a little bit among all the different healthcare professionals. So at the beginning of the presentation, Kevin mentioned that there was a list of different professionals. I'm going to go into a little bit more detail as in like what do they do each and what differentiates them. So let's start off with pharmacists and doctors. So pharmacists, as we have said before, Kevin, it was mostly for the use of proper medication, and we ensure the effectiveness of them, and we monitor for drug interactions. Whereas doctors, their job is mostly to diagnose and treat illnesses like injuries or medical conditions. They can order tests, create treatment plans, prescribe medication, and monitor patient progress. Now, if we talk about the other ones, so the nurse versus nurse practitioner, if you need vaccination, a checkup, or management of a chronic condition, NPs sometimes can also prescribe medications and labs depending on the situation. Dentist, so yes, if you have toothaches, need a cleaning, or if you require a cavity filling. An optometrist, if you have blurry vision, you need glasses, or you have a need of contact lenses, or you want an eye exam, you can always go to them. And then for physiotherapists and occupational therapists, if you have, let's say, an injury from whatever source and you need help regaining movement, they will help you with exercise and everything. Nutritionists and dietitians, if you need advice on managing diets, weight loss for diabetes or food allergies. So now we want to distinguish when is it important to prioritize to call a pharmacist versus calling a doctor. So usually pharmacists, you can call them for, let's say, refill delays, minor side effects, minor conditions, vaccines, over-the-counter medication counseling, and most importantly, redirection to the proper healthcare professional if you don't know what to do. And then the doctors, if you have new severe symptoms, like for example, a newly developed chest pain or difficulty breathing, pain management, diagnostics, and annual checkups. After reading this statement on the slide, you think you should contact in this specific scenario. So for example, if you develop a small rash on your body after starting a new antibiotic, in this situation, who would you contact first? So in this specific situation, the answer would be a pharmacist. Because in this situation, it's a small rash, and usually, as V has presented before, pharmacists can sometimes adjust the medication for you. So the next question is, if you develop a full body rash and have constant diarrhea after starting a new antibiotic, in this situation, who would you call? So in this case, if you have a full body rash, it's better to call, and a constant diarrhea, it's very important to see a doctor, because in this case, you might have a severe allergic reaction, and it's important to see the doctor to, first of all, resolve this allergic reaction, and second of all, like reevaluate to see which antibiotic would be more adjusted to you. If you develop a painful looking rash on your body, like in the picture, within 72 hours of its appearance, who would you call? It says within 72 hours. So usually if you see a rash like this on your body and it's been less than 72 hours, it's okay to go see the pharmacist, because as V has presented, it's possible for us to prescribe an antiviral, and that can help you heal faster. The next question is, if you develop a similar painful looking rash on your face within 72 hours of its appearance, who do you call? So as we has presented before, when the rash is on your face, it's very important to go see a doctor because it might lead to other more serious complications. So it's very important not to waste time and to go see a doctor directly. So for the next question, if you develop a cough with green colored mucus and have trouble breathing, in this context, who do you think you should call? When you develop a cough and there is colored mucus, it usually suggests either a bacterial infection or a viral infection that needs the prescription of certain antibiotics or antivirals, which in this case doctors can do. Especially if you have trouble breathing, it might like suggest something more serious, so it's very important to contact your doctor. And then finally, if you develop a cough without colored mucus nor trouble breathing, who would you contact? So in this case, you can see that the symptoms are more mild, and it's not does not suggest anything underlying more serious. So in this case, you can contact your pharmacist, and we can suggest you on some over-the-counter medication that might relieve your symptoms. So one last more important thing to remember is that one of the role of a pharmacist is to redirect you to the proper healthcare professional. So if you're in doubt and you're not sure what to do, it's always good to just call us, and we can potentially help you, listen to you, and then guide you to the right resources that can help you.
So now I'm going to talk about a few online resources that are available to you to help you age in place. First of all, the CDC publishes various articles about aging in place. Here I have two of them. For example, there's one about fall prevention in older adults and one about respiratory viruses. So those are interesting topics that you can read about on the CDC website. And then the centers we work for, which is the CHSSN West Central Montreal, there's a support program for the autonomy of seniors. And there's different services that are available to that we offer. There's a home care, long-term care, telehome care. So for home care, on their website, there's contact information for various CLSCs in our centers. And then certain healthcare professionals offer their services to you. So psychosocial workers, occupational therapists, physiotherapists, and nutritionists as examples. And then on the website, there's also info about long-term care and how to access it. There's also contact information for the site coordinators on the website also. And finally, there's also telehome care, which involves a nurse who monitors your health status remotely for chronic conditions. And they coach you on how to manage your condition. And the goal is just to empower you to manage your health in the comfort of your home. And then the government of Quebec has a immunization program. So there's on their website, there's a vaccine schedule for adults. So for example, for the pneumococcal vaccine, once you're 65 years and older, we recommend getting um, your doses for the pneumococcal vaccine. And there's other vaccines on the website, and everything's listed as per the schedule. And finally, the Ministry of Health and Social Services of Quebec, on their website, there's vaccine information sheets for each vaccine. For example, on the right, you can see there's a vaccine sheet, information sheet for the pneumococcal vaccine, and it's an interesting read. And every vaccine has one of them, and they're both in French and English. So it's interesting for reference. So that's it for the presentation. Now it's the questions and answers period.
Okay, so the first one was like going back to the first poll question that you gave us, where you mentioned that pharmacists can adjust the medication. Does that mean that pharmacists can also change the medication, or is it just adjusting the medication? That was the first question that came up.
So we can change the medication, but it's just in specific circumstances, meaning I can pull out again the slide about this. Um, so for example, we can substitute, this is what we call substituting the medication. And you can change the actual medication that you have to another one, but it's only if ever, for example, the drug is out of stock, if it's not available, or if it's not safe for you to take, or it has been shown to not be effective for you. So those are the specific conditions for it, that we can do that for.
Somebody had a specific example, and I know those are sometimes a little bit harder to answer, but if you can, they said my pharmacist wouldn't increase my blood pressure medication when my blood pressure was high. He told me I needed a doctor's order.
I think in this situation, it really depends because if, let's say, a pharmacist needs to change your blood pressure medication, they'll have to monitor the blood pressure for a few weeks just to see the trend of the blood pressure. We can't adjust the medication based on a single value of blood pressure. So usually when you go to a pharmacy and speak to a pharmacist and you ask them, oh, is it possible to switch my medication? We will usually make follow-ups with you. We'll plan follow-ups with you for like about 2 to 3 weeks, and during that time we will ask you to measure your blood pressure usually twice a day and at different times of the day, so that way after a good week we would have a trend of your blood pressure, and then at that time we can evaluate if it is effectively necessary to adjust your blood pressure medications or if it's not necessary and it's only that single value that is high.
I'd like to add, it also depends per pharmacist. Certain pharmacists aren't as comfortable because these are new rights that were given to us in the last couple years. So some older pharmacists who aren't used to adjusting medication like that, like for high blood pressures, they're not going to be as comfortable doing it. So they can refuse. But you can. There's certain other pharmacists that are like us, where we're very comfortable doing that. So we'll do it for you, and we'll make sure we follow up, like Lindsay told you guys. But yeah, it really depends on each professional.
It makes me think about whether it's possible for you to tell us a little bit more about Law 31. So we know that it exists, we know that it's changed and increased the amount of things that you're able to do, and we know that a lot of people have trouble accessing a family doctor or reaching their family doctor. So that's, this could be a really positive thing, but I don't know if we have a lot of clarity on what is Law 31. So are you able to share a bit more about that?
So Law 31 is a new law that's been made for pharmacists that gives us a bit more rights, to be able to, for example, the things that I've been describing you in terms of the prescriptions, the changes of medications, the things that we can give you, administer you, or monitor your medications with. Those are all parts of Law 31 that just gives us more activities to be able to do things when you cannot have access to your doctor. It was started initially more during COVID when you guys for sure was not able to have as much access to a doctor. And it's just been continued until now. And there's
Mm-hmm.
also in the works of another new law like a law project for us to be able to do even more. Though we didn't talk about it in this because it's not as clear as when it's going to be
I
like
see.
put into place.
Can people contact a pharmacist to see if supplements are okay to take with your meds, or are all supplements okay?
Usually, we would always suggest you to contact the pharmacist if you want to take natural products, if that's the question, because certain natural products can increase the chances of bleeding and things like that. And some elderly, they're on anticoagulants, and this is very important because we don't want to increase the risk of bleeding. So I would say to always contact your pharmacist just to see if it's safe to combine certain medications.
Can you give examples? So there was a slide where you gave some information about the CLSC and the SAPA program, and a question came up about whether you have any examples of when to call the CLSC versus a pharmacist.
So for the CLSC, because the CLC doesn't usually they don't have pharmacists there. So if you have anything that doesn't require a pharmacist, so if you need a nurse, nutritionist, physiotherapist, or any other healthcare professional, you should contact the CLSC. But if it's medication um, related to medication, then you should call your pharmacist.
Can a pharmacist refill a prescription that was given in another province?
It has to be done by transfer, meaning that we'll have to contact the pharmacy from where you were in another province if you do have renewals left, um, and be able to transfer that prescription to our province, and we can then give it to you. But yeah, it's just there's a couple like technicalities, but we can, yes.
Can you prescribe, because I know you mentioned a few different cases where if you had a prescription in the last 5 years, you can renew the prescription. Does that apply for sinus infections as well? I know it's very specific, but that's an
Mhm.
antibiotic, not an antiviral, and yeah.
So, specifically, you guys can double check me, but no, not for sinusitis specifically, or like the infection of your sinuses. We can't re-prescribe those. You'll have to go see the doctor again for that.
Okay. Yeah.
So it's
Okay.
generally a lot of like either chronic conditions or conditions
Yeah.
that are at low risk of having like complications that we can re-prescribe,
Right.
or some
Right.
that are really so acute that we should give it right away, and then after you can be evaluated by another health professional.
Can a pharmacist interpret a blood test result and prescribe accordingly?
That depends. For example, if you have a thyroid disease, then in that case, we will have to prescribe a blood test just to monitor the function. So we call it the TSH level to see if we have to adjust the medication, usually called Synthroid. And in that case, yes, we have to prescribe blood tests and we can interpret them, but that depends on the condition. So if we are following up that chronic condition, we could prescribe blood tests. But if we are not following and it's like an acute condition, then in that case, we wouldn't prescribe blood tests just to diagnose things.
Okay, someone wanted some clarification on antiviral prescriptions for the flu. Um, are they available for people of any age, or is it more for people who are at risk because of age or because of health conditions?
It's really specifically depending on your risk factor. Because, for example, when you're young, like it's normal to have the flu, to have like being sick at times, but you have the immune system to fight it off. But for sure, if you're when you're a bit older and you have a certain health issues, it can make it way harder to fight it off and can create complications. So we can only prescribe them if ever you're in a certain pool of patients that are more at risk of those complications, or and yeah.
Okay, is there an age cutoff, like an age where you're considered to be more at risk, or is it more related to health conditions?
It's an age and health
Oh,
condition, so it's not just, for example, like you're a bit older than we're like, for example, if you're is it 65 or 50? 65, right?
It's 65, yeah.
If it's
okay.
above 65, generally you're more at risk. But if that's the only risk factor in your like in your condition as a
Profile.
patient for us, we're not going to prescribe it automatically. It's really depending of how frail you are or how at risk of complications you are.
Okay. Yeah, that makes sense. Someone was asking about sort of the cost of shingles vaccines, and how at some pharmacists it seems that there's a fee, and other pharmacists maybe it's free, maybe it's related to your age. So questions about like the cost of the shingles vaccine, and do you need to have 2 doses? I'm putting 2 questions together, but
Um, you can answer, Lindsay.
So for the shingles vaccine, yes, you have to have 2 doses. For the price, well, it depends again on the age. So if we remember the resource that Kevin presented, there's called Quebec has like a resource called LivPIC, so the Protocol of Immunization of Quebec. In that specific website, you can see there are criteria. So for certain vaccines, if you reach a certain age, it becomes for free. And sometimes, well, in other cases, when you're not at that age, then you'll have to pay. So for the shingle vaccine, I think by memory, the age limit was like 75.
It's 75 and up, yeah.
75, you have to be 75 for it to be free. But if you're less than that, let's say shingles, they say like, oh, after 50 years old, you're more at risk, and we recommend you to get the vaccine. But in that case, unfortunately, you do have to pay, and the amount is different depending on the insurance that you have.
okay. Yeah, thank you for clarifying. Um, Someone had a question about protocols around UTI, because I know it was presented as something that you can prescribe for, but one of the people here today said that they had a recurrent UTI and the pharmacist gave them the antibiotic for 3 days instead of 5 that they usually take, but didn't ask for a urine sample. And then when they saw the doctor was a little bit upset because there should have been a urine sample. So is there any, and can the pharmacist do the urine sample, or is that done with the doctor? So like, what is the protocol exactly for people with presenting with UTI?
So it's a really case by case type of situation, because there's some UTIs that are
Yeah,
a bit more complicated, they're a bit more recurrent, and so the bacteria sometimes can build what we call a resistance to certain antibiotics that you've already taken, meaning the antibiotic you've taken is not effective
working.
anymore. So it's really a case by case thing. Sometimes the pharmacist will, for example, prescribe a different antibiotic because the ones that you see that you've taken a good couple of times, so it might not work anymore. And depending on the antibiotics, there's a different duration to it.
Mm,
But in terms of urine samples, we cannot, it depends. We, as like general pharmacists, we can't prescribe them to diagnose the UTI itself and to be able to see like what type of bacteria you have or whatever. But some pharmacies have what we call like collective orders, meaning they're partnering up with doctors and the doctors let them prescribe it for them. But it's really specific pharmacies. I can't tell you like it's an automatic for all of them.
mm. Okay, the next one is around the tetanus vaccine. So if somebody has a minor injury that may require getting a tetanus vaccine, can you show up to the pharmacy for that? Yes.
Yeah, yeah, you can. So you can just, we'll have to evaluate you for sure. So see if you actually need the tetanus vaccine, but there's no issue with us prescribing you and administering to you. It's just that, for example, if you have it's from a injury of, you might have to go see a doctor then. We might like put you to go see a doctor after, but the tetanus itself shot, we can give it to you.
Okay. Yeah, that makes sense. I guess if there's like a risk of infection or risk of
Mhm.
like if the injury is that severe. Okay, let's keep going. What about the removal of ticks? Is this something that pharmacists can do? Can you help to remove ticks and prescribe medication for that?
Usually for ticks, removal, it depends on the pharmacist. Some pharmacists are comfortable doing that, they can do it, and others are not comfortable removing them. So they'll suggest you like a pair of like tool to help you remove it, but they could definitely prescribe the medication to prevent like the Lyme's disease, but that's also depending on certain criteria. So let's say you have the tick on yourself for more than 24 hours and you've taken it off and you've taken it off and it's been less than 72 hours. In that specific scenario, we could prescribe the medication, and others, if let's say the tick has been on you for 30 minutes, then in that case, it might not be prescribed. But then again, depending on the pharmacist and how comfortable they are, but yes, they could prescribe medication.
Can a pharmacist prescribe for a rash that's not related to shingles? So a rash that sort of comes and goes that has no clear, like, where it came from.
Yeah, no, I get you. It depends. It really depends on the rash. It depends, like, because there's a lot of different types of rashes with a lot of different types of causes to it. So we can prescribe for some of them, meaning, for example, if you have eczema, you're known for eczema, and you've had a prescription for your cortisone cream in the past, we can prescribe you that again or prescribe you a different one.
Mhm.
And if it's, for example, if you've touched, for example, poison ivy or something that can cause you a more of an allergic type of rash, then we can prescribe for that too. But if it depends on the rash itself. Sometimes it does require to see the doctor because it is something that we cannot diagnose, or it's something that maybe be more at risk of something that we don't know yet, and that should require the doctor's attention.
The two last questions that came in before we do our final thank yous are, can nasal sprays be prescribed?
Yeah, we can prescribe them, but it's for a specific, if ever, it's for like seasonal allergies. So for example, if you have like it's it's kind of the season for allergies right now, seasonal allergies, and you have like a really constantly congested or leaky nose, we can prescribe you a spray.
Okay, that sounds good. And do, 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 do. Is it better to call 311 or talk to a pharmacist? Like, can you help to distinguish when each one is more appropriate?
So for calling pharmacist is like we said, like previously, if you have minor conditions and everything, and or if you're not sure, you can always call us and we will evaluate the situation and tell you if it's necessary to call 311 or not. So
Okay,
like with us, we can help you see if it's necessary.
perfect. Perfect. And last thing, are you able to prescribe vitamins and supplements?
That
No.
depends. Oh,
It
did
doesn't
you?
need to be prescribed though, most of them.
Yeah,
Mm,
so most of them are you can buy them over the counter, but it's just important. For example, magnesium, it's known for causing diarrheas, things like that. And if you take too much of it, it could potentially not be that necessary. So we would always
mm.
actually tell you to like have a blood test or an annual checkup with your doctor. And if your blood test turns out normal, then it's not necessary to take extra supplements. And if you are in fact like lacking some of the elements in your blood test, then in that case, yes, you can get supplements.
Okay, so it's something we can talk to you about as well. Yeah. Okay. Thank you so much. Really generous presentation. Everyone, a lot of people think they have already said that they've learned new information. And I think it's a really great resource and a really great tool, like really great to know that we can go to our pharmacist to help us to age in place. So I just want to send a huge thank you to V, Lindsay, and Kevin. Thank you. And we're going to be taking a break after this for Sharp. Our next Sharp is going to be in September. So I'm going to take this opportunity to wish everyone an excellent summer, and I look forward to seeing you in the fall.